Here's another one from thehill.com. Obamacare death panel faces growing opposition from Democrats. Most of the health care stack that I have today, if I had to summarize what every story in it's about, it can't work. Obamacare physically, financially, practically cannot work. It's too big. It's a leviathan that simply cannot be tamed. It just can't work. Every story would fall under that umbrella. Hill.com. Obama's cost-cutting board, memorably called a death panel by Sarah Palin, is facing growing opposition from Democrats who say it'll harm people on Medicare. Former Democrat National Committee Chairman Howard Dean drew attention to the death panel designed to limit Medicare cost growth when he called for its repeal in an op-ed last month. But Howard Dean's not the only Democrat looking to kill it. A wave of vulnerable Democrats over the past 3 months has signed on to bills repealing the powers of the death panel. They include Senator Mark Pryor, Arkansas, Representatives Ron Barber, Arizona, Ann Kirkpatrick, Arizona, Kirsten Sinema of Arizona, and Elizabeth Esty of Connecticut. All five are considered vulnerable in next year's elections, highlighting the stakes and the political angst surrounding the health care measure. And so now you've got a bunch of Democrats say, wait a minute, when the death panels, we don't want to deal with this. This is going to hurt Medicare. Why would it hurt Medicare? Because the death panel has the ultimate power to determine who gets treated and who doesn't. Not covered, treated. The death panel determines who is going to get treated. Medicare pays for the elderly to be treated. The death panel trumps Medicare and Obamacare. Medicare has been gutted to boot. So the next story is from CNNMoney.com, where Obamacare premiums will soar. Get ready to shell out more money for individual health insurance under Obamacare in some states, that is. While many residents in New York and California may see sizable decreases in their premiums, Americans in many places could face significant increases if they buy insurance through state-based exchanges next year. Now, by the way, this claim here that residents in New York and California are going to have lower insurance rates under Obama, that is, folks, that's an abject lie. And the news of the day is the evidence. The news of the day for the past month or longer has been all about rising premiums in California and New York and insurance companies pulling out of there by design, by the way. Now, you would almost think with this story that CNN was going to commit a random act of journalism, but they don't. Instead, they push a bunch of myths. First, they claim that rates are going to go down in New York and California under Obamacare, which has been debunked. They won't. And then they claim that those states that have bare bones plans, when in fact states have high rates because they already require insurance companies to cover a lot of the nonsense mandated under Obamacare, pre-existing condition stuff, which isn't insurance. That's welfare. That's another story. From CybercastNewsService.com, Blue Cross, Aetna, United, Humana, 4 insurance companies have pulled out of the Obamacare exchanges. All part of the plan. Private insurers are being forced out of the market. This is part of the Obamacare long-term plan to make it so that only government has insurance to sell. Major health insurance companies, Blue Cross, Aetna, United, Humana, have decided not to participate in various states in the Obamacare health insurance exchanges. That'll be the only place Americans will be able to buy a health insurance plan using the federal subsidies authorized under Obamacare. Under Obamacare, every American must buy a health insurance plan that meets minimum government specs. If a person does not get health insurance through their employer and it's not on Medicaid, they can buy insurance through their home state's insurance exchange, which, depending on the state, is going to be run either by the state or the federal government because not all states have signed up to open an exchange. The states will operate exchanges where small businesses can buy health insurance plans. And when you go to the exchange, if you go to a website, there are going to be a number of insurance companies there offering plans, and theoretically, you're going to have freedom of choice. You're mandated to go there. You're mandated to buy a policy. And while you're there, you can choose. Well, what happens when Blue Cross and Aetna and United and Humana pull out? Right there are 4 insurance companies taking their business out of there. That's going to result in less competition, and it's all by design, folks. This is all part of the plan. The long-term Obama plan is to eliminate private sector insurance as a business, because the long-term objective is single-payer, government-run health care. And they know that they just can't wave a magic wand and say, starting next year, all private sector insurance is dead and you have to go to the government to get your insurance. Nobody would put up with that. So the way Obamacare is designed is to make it impossible for people like Blue Cross or Aetna or United or Humana to make a profit. Therefore, make it impossible for them to stay in business. So what will happen is these evil, greedy private sector insurance companies will pull out. And Obama and the Democrats are running around saying, see, you just can't trust the private sector. See, these people only care about profit. See, they don't care about you. They don't care that you're sick. They don't care that your grandmother's sick. All they care about is their profit. Well, good riddance, when the truth will have been the characteristics of Obamacare have made it impossible for them to stay in business. So it's actually quite brilliant. Obama and the Democrats want the government to be the sole place any of us can go for insurance, but they can't mandate that in a law. Nobody would support it. So they structure it so that happens anyway, and it appears to happen because private sector insurance companies are a bunch of rotten SOBs who would rather pull out than provide you with insurance for health coverage. And so the government will be there as a savior. The government will be there as a stopgap to save you from the evil clutches of these private sector rich guys who probably vote Republican, who don't care about you. That's how it works. And it's working. It's when Blue Cross and Aetna and United and Humana pull out, that's all part of the plan. 2 more stories. Washington Examiner. Most of the 24 healthcare co-ops, the exchanges created under Obamacare, are in danger of running out of money before they even open. Running out of money before they even begin offering health insurance to consumers. This according to the Inspector General for the Department of Health and Human Services. Now, California got $900 million. They've blown through it almost out of money. Finally, Obamacare months behind in testing its IT data security, meaning, I'll have to say this for tomorrow, it's kind of complicated, but when you go in to an exchange and sign up, that data is not secure. They haven't got any security on the IT, so when you go sign up, it's not encrypted, nothing. I'm telling you, it's a debacle. So, let's review. You have to buy insurance. Rates are skyrocketing, but you can get a subsidy. But you can only get a subsidy through the exchanges. But the companies aren't offering individual plans via the exchanges because they're pulling out, which means individuals aren't going to get a subsidy. And they're going to have to pay through the nose or pay the Obamacare penalty or tax or fine for not having insurance. That's where we're headed. The subsidies come from the private sector guys, and they're pulling out. I mean, in one sense, they do. I don't. This can't work, folks. It cannot.